name is Peter Haddad and I'm an Honorary Professor of Psychiatry at the University of Manchester in the United Kingdom. I'll be giving a presentation at the Psychiatry Masterclass on the history of psychopharmacology. The 1950s and 1960s witnessed the introduction of the first antidepressants and antipsychotic medications. Prior to this, there were no specific pharmacological treatments for psychiatric illness. These new medications improved outcomes for patients, helped to reduce the stigma associated with psychiatric illness, catalysed basic science research, and led to parallel developments in clinical trial methodology. The excitement of the 1950s and 60s was followed by a relatively fallow period for psychiatric drug development, before a second period from the late 1980s to approximately 2010 that witnessed many new medications being approved. These drugs were developed through research programs that targeted specific mechanisms. This contrasted to drugs that entered practice in the 1950s and 60s, which were largely developed by serendipity. Unfortunately, the last decade has seen only limited advances in clinical psychopharmacology. However, the need for new medications is huge given the global burden of psychiatric illness and the limited effectiveness and side effects of existing medications. Revitalising psychiatric drug development will require a range of strategies, including a concerted research effort to better understand the underlying pathophysiology of psychiatric disorders. Finally, it's very important to remember that psychopharmacology is just one aspect of the treatment of severe psychiatric illness. The best outcomes for patients with severe mental health disorders are achieved when medication is used appropriately in combination with psychosocial interventions, and these are delivered through accessible and local services.